I believe. Good. All right then. So what I was showing you, I was talking about the inferior thoracic aperture. So I was just right here. I added the connective tissue, and down here. So you've got on the sides, first of all, the anterior border would be xiphisternal joint, then the costal margins, right? Then posteriorly, you would have the rib 11 and 12 until you're reaching the 12th vertebra. And also the same thing is happening from the other side, all right? So that's the inferior thoracic aperture. But still, what's going to happen is that if I add up the muscles, so you can see the diaphragm is basically filling up the whole inferior thoracic aperture, except that it's leaving like a bunch of openings for the major structures which are passing between the thorax and the abdomen, all right? Which we will learn later on. Okay, then. So that's pretty much about the thoracic apertures. Now we are actually making it to the actual thoracic wall. So then the thoracic wall is formed by the ribs, sternum, and their, let's say, associated muscles which are attached to the ribs, plus the skin and the subcutaneous tissue. All right. So it's just quite easy. So the ribs, associated muscles, and, or in a better way to say, thoracic cage, associated muscles, and the subcutaneous tissue on the skin. So these guys are forming the thoracic wall. So if I add up all the muscles, so you can see the pectoralis major, then deep to it you can find the pectoralis minor, but still you know that these are the muscles where these are the axio-appendicular muscles which are acting on the upper limb, all right? So they are attached to the thoracic wall, but they are not the true muscles of the thoracic wall. So between the ribs, I can get to see a bunch of muscles which are the muscles which are filling up the spaces existing between two ribs. The spaces over here, which you can find between each rib, these are called as intercostal spaces. You've already heard about them. So the muscles which are filling the intercostal spaces are called as intercostal muscles. Okay, so definitely you heard about the intercostal muscles. So right now we are going to talk about the major muscles of the thoracic wall, but I will leave the intercostals as one of the last muscles to talk about. So let's talk about some minor muscles that you don't really ask you to show them. You will be able to talk about a muscle, or you will be able, you're able to see a muscle over here, which is called as serratus posterior. But the thing is that the serratus posterior is like, there are two of them. There is superior and inferior. Serratus posterior muscle, well, it's said to be that it's having like these kind of inspiratory functions, all right? So the thing is that it's having attachments to the lower cervical vertebrae and the upper thoracic, and is running obliquely down toward the ribs. So the serratus posterior superior is responsible for elevation of the upper foreribs, and serratus posterior inferior, as you see that it's arising from the lower thoracic and the, let's say, up to down to the L2 lumbar vertebra, and it's attached also to the lower ribs. So it's responsible to depress the lower ribs. Okay, so that's pretty much about the serratus posterior muscles. They don't really ask you to show them, so then just know that such a muscle exists over there, and don't really get stuck with the attachments. Right now, what I want you to focus on is to focus on the ID, all right? You will have time to go over the, let's say, more of the theoretical things in the exam period, but right now you have to focus on the ID because other self-controls are coming up, so then you have to use your time properly, all right? Then there is the other muscles that you can mention. These muscles are seen over here, and they are called as levator costernum. Okay, so levator costernum muscles, the name is telling you that these muscles are responsible for rib elevations. They're arising from C7 till T11. So there are 12 pairs of muscles on each side, and they are arising from the vertebra above, and they're inserting to the, for example, first rib, second rib, until down to the 12th rib. So levator costernum muscle is responsible for elevation of the ribs. So in the table from the book, in the attachment, if you see here, it's written from T7 till 11, which is wrong. It should be from C7 till T11. Okay, so that's pretty much. Then another muscle that you can mention. So I already told you that the muscles, the 11 pairs of muscles that you find between the ribs, they are called as intercostal muscles. Below the 12th rib, there is another muscle which is called as subcostal muscle. Okay, I will just tell you about it later on quickly. So let's talk about the intercostal muscles. Then we will get to talk about the rest later on. So if we take a look at the muscles over here, so you're looking at the see the external intercostal muscle really nicely. All right. So external intercostal muscles, as you're looking at them, first of all, they are helping with the inspiration. But the thing is that I want you to remember that the major muscle which is responsible for basically breathing is the diaphragm. All right. These muscles, they are accessory muscles. For example, if you're doing forced inspiration or forced expiration, these muscles could be like involved and help with the movements of the ribs. Otherwise, during the normal breathing, it's just mainly the diaphragm which is doing the whole thing. All right. So then, as we see over here, so we have the external intercostal muscles, which is the outermost muscles, could be found in the intercostal space. Okay. So the thing is that what you have to keep in mind, once you're looking at the external intercostal, then more anteriorly, deep to it, you find the internal intercostal muscles. But what I want you to know is that on the cadaver, you will, once you find the external intercostal muscles anteriorly, these guys, they are replaced by a membrane, like what I draw. So you will be able to find a whitish tissue over there, or whitey membrane over there, which is called as external intercostal membrane. Okay, so once you kind of remove this membrane, then you're able to find the other muscle fibers deep to it, which are the muscle fibers of the internal intercostal muscle. So remember, on the cadaver, when you're looking at the anterior view of the thoracic wall, so over here, as you see, you're looking at the external intercostal muscle, and there you have this white, you have this white tissue over here, which is the external intercostal membrane. Then deep to it, you will be able to find the muscle fibers of the internal intercostal muscle. Okay, so that. And what else I want you to tell you is that external intercostal muscle is an inspiratory muscle. So it's helping with the inspiration during the movements of the rib cage during the inspiration. All right. The next guy. So as we are running deeper to the external intercostal, as I told you, you'll be able to find the internal intercostal muscles. Okay. So internal intercostal muscles, first of all, the direction of the muscle fibers are, well, kind of opposite, because external intercostal muscles are facing anteriorly and inferiorly, but the internal intercostal muscles are running in the opposite direction. Okay, so it's like kind of crossing each other. All right, so imagine that, let's say you're standing, okay, and let's say you have your legs, for example, here. These are the legs and the feet. So you have a pocket in your trouser, right? If you put your hand into your pocket in a way that your thumb will be out, okay, so let's say your other four fingers, they are facing like that in your pocket, and the thumb is outward, so it's facing like that. So those fingers, they are resembling the external intercostal muscles direction, and the thumb, which is out of the pocket, it's parallel with the fibers of the internal intercostal muscles. All right. Or in another way that I learned it before is that the external intercostal muscles fibers, their direction is toward the external genital organs. Okay, that's one way. And then opposite to that, you've got the internal intercostal muscles, which are having the opposite direction. So external goes with the external. Okay, so that's the thing over here. So we've got internal intercostal deeper to the external muscles. And remember, internal intercostal muscles, they are active during expiration time. Okay, so they are expiratory muscles. All right, so if you remember, I told you that the external intercostal anteriorly, it's replaced by the external intercostal membrane. Okay, so we should have the very same thing to happen for the internal intercostal muscle. But the thing is that since almost everything is opposite with these muscles, so since we have the external intercostal membrane located anteriorly, so then we have to expect that the internal intercostal membrane is located where? Posteriorly. Okay, so what I'm gonna do, we are taking a look at this picture. So here is the cross section of the thoracic wall. All right, so there's the skin. Then here you can see, well, the muscles, external intercostal muscle, and deep to it you have the internal intercostal muscles. As I told you, external intercostal muscles over here anteriorly, it's replaced by external intercostal membrane. But then once these muscles are getting closer toward the vertebrae, the internal intercostal muscle is replaced with internal intercostal membrane. Okay, so the whole thing is located right opposite to each other. So if I move it down to this picture, this is the anterior view of the vertebral body. Okay, and you can find the joint between the head of the ribs and the vertebrae, as you see here. So over here you have the external intercostal, then you've got the internal intercostal. And remember, the innermost muscles, which are the actual deeper layers of the internal intercostal muscles, they are called as innermost intercostal muscles. All right. So then, if we are following the whole thing more posteriorly, so you can see that instead of the internal intercostal muscle, there is a membrane, which is the internal intercostal membrane. So right opposite to what we had compared to the external. So external is anteriorly, internal is located posteriorly. All right, perfect. So the third intercostal muscle that we have is called as innermost intercostal muscle. Okay, so now we've got then in order the external, then internal, then the innermost. But on the cadaver, you don't really get to see a difference between the internal and innermost intercostal muscles. So as we said, innermost intercostal muscles, they are the deeper fibers of the internal. Okay, and how would you be able to differentiate between them? The thing is that over here, from the more posterior side, so let's say you know that the spinal nerve is running down over here, so it gives you the spinal nerve. Okay, so the anterior rami of the spinal nerves, they form the intercostal nerves, which you find them running together with the intercostal artery and vein in each space. So if you follow the intercostal nerve and vessels, they are just running deep to the innermost intercostal muscles. Okay, so over here, if you look at this cross section or of the bone, so you can get to see that you have the internal intercostal nerve and vessels, they're actually kind of sandwiched between the innermost and internal intercostal muscles. Okay, so then at least you have to know it theoretically that the neurovascular bundles, they are running between the internal and innermost intercostal muscles. So that's the key point for you to at least mention it to your examiner in the exam. So external and internal intercostal muscles are easily seen. If they ask you to show them the innermost intercostal, just show them the most internally located muscle fibers, and those muscle fibers belong to the innermost intercostal muscles. Okay, so again, if you see on this like full cross section or transverse section, so you see the external intercostal, then internal, then you have the nerve, then innermost intercostal muscle. That's the order what you see over here. All right, so functionally, innermost intercostal muscle is also working together with the internal intercostal, since even their muscle fibers are just running parallel with each other. So these guys are expiratory muscles. All right, so what we see over here, you just imagine that the cadaver is lying in front of you, so you're looking at the anterior thoracic wall. Okay, so you can see the sternum, you can see the ribs, clavicle, let's say part of the pec minor muscle, and so on. All right, so you can see the external intercostal, and deep to it, or deep to the membrane, at least you can see the internal intercostal muscles fibers. But now what they've done on the cadaver, actually from the sides, they have cut off the like the thoracic wall, so you can actually take it out. And of course, you know that deep to that, you will be able to find the lungs, and you'll be able to find the heart. So once you take out the thoracic wall, then if you rotate it and look at the posterior side of it, this is how you're looking at it from the back. Again, look here, so you can see the sternum, the posterior surface is even written here. You can see the posterior surface of the ribs and everything. So the muscle fibers, you find that they are running obliquely, they are belonging to the internal and innermost intercostal muscles. Okay, so just say internal intercostals is fine. But the other muscle that you're able to find is this guy, which the fibers are actually running transversely. See, on both sides. So this muscle is arising from the posterior surface of the sternum and is attaching, let's say, to the second, third ribs down to the sixth rib. So the muscle is called transversus thoracis muscle. All right. So transversus thoracis muscle, it's really nicely visible on the cadaver. Okay. So once you take out the, let's say, thoracic wall, the muscular and bony part of it, once you're looking at it from the back, so you can see the transversus thoracis muscle really nicely. From the other side, remember that you're able to find maybe another muscle attached to it and it's cut, and that's part of the diaphragm. You also have to remember that, which is really, really, really important. Okay, so that's pretty much about it here. So about these muscles, I wrote just some basic details like as a text, so it's just enough to read over them. And also remember about the transversus thoracic muscle, it also has expiratory function. All right, perfect. Okay then, so about the subcostal muscles, you also like just mentioned that they are located there, like nothing much to be asked. Okay then, so these are the like major things that I want you to know about the muscles. Something else that I will have to mention is that, let me show you on the application because it works much better. So if you're looking at the intercostal muscles, okay, so if you're looking at the external intercostal muscles, you're able to see that the fibers are actually running down. I mean, on the cadaver, it's more like that. So they are kind of continuous downward with another abdominal muscle. So external intercostal, then inferiorly, we say that it's continuous with external oblique muscle of the abdomen. Okay, so in the abdomen, you have again 3 layers of muscles exactly the same way that you have here. So external intercostal fibers, they are continuous with the external oblique muscle. Now, if I hide the external oblique muscle, then you can see that you have another muscle which the fibers are running parallel with the internal intercostal. So these guys are continuous with each other. And these muscles down here, they are called as internal oblique muscles of the abdomen. So you see, the same order is preserved. And if you remember, I told you that we have the transversus thoracis muscle over here. So you can actually see it even on the cadaver in your practice room. You can see that the transversus thoracis muscle inferiorly, it's continuous with another muscle fibers or some other muscle fibers straight, which are also running down transversely, and that's actually the part of the abdominal wall. So then that muscle is called as transversus abdominis muscle. Okay, so then we can say the major intercostal muscles and transversus, they are continuous with the oblique muscles of the abdomen and transverse muscles of the abdomen. So external intercostal is continuous with external oblique. Internal intercostal is continuous there in the same way with the internal oblique, and posteriorly, so more deeply, transversus thoracis is continuous with the transversus abdominis muscle. Okay, so these are just like extra things. I just want you to hear them now. So later, once you move it to the abdomen, then you're gonna be like, oh yeah, that's the one we read about it that time. All right. This was pretty much about these muscles. About their innervation, well, intercostal muscles and the transversus thoracis muscles, just you can just mention the intercostal muscles. Even for serratus posterior muscles, again, you can mention the intercostal muscles, but still to be more specific, for the serratus posterior superior, well, in the book it says second to fifth intercostal, and inferior it says, let's say, 9th to 12th thoracic nerves. So let's say 9 to 11th intercostal and T12 nerve. I will tell you later that we call it as subcostal nerve. Okay. Then levator costernum muscle, which is located more posteriorly. So we know that the spinal nerves, when they are coming out, they are giving us the posterior rami. Okay, so the posterior rami of the spinal nerves, they are the ones to supply the levator costernum muscles. So you can just use this table like shortly, but don't get into details because it will just take you a lot of time and it doesn't worth it. So just focus on what you can ID. All right. One more thing to tell you. Once you're looking at the posterior view of the anterior part of the thoracic wall, remember, you will be able to find an artery and vein running downward vertically, and they are actually going down then deep to the transversus thoracis muscle. So then these vessels are the actually internal thoracic vein and artery. So internal thoracic artery, you know that it's arising from the subclavian artery, and then you have the internal thoracic vein running right next to it. Okay, so that's how you can find the internal thoracic vessels. We will talk about them later on today. Now, another thing that you will have in your topics somewhere is the fasciae of the thoracic wall. Such an easy and nice topic. So if you see over here, so if I add up the muscles, we have the pectoralis major. There is a fascia covering the pectoralis major muscle. That fascia is called as pectoral fascia. Good, easy. So once you pull over the pectoralis major, then you will be able to find the pectoralis minor muscle deep to it. And you know that so then a fascia you have that it's arising from the clavicle and it's suspending down and it's covering the pec minor muscle. And that fascia is called as clavipectoral fascia. Such an easy one. So in order, then we had pectoral fascia to cover the pec major and clavipectoral fascia to cover the pec minor muscles. Now, if you look over here at this horizontal cut that we have on the thoracic wall, so internally, you're able to find a fascia which is covering the whole internal aspect of the thoracic wall. So you're not actually able to see any of those muscle fibers right now. So there is a specific fascia covering the whole internal aspect of the thoracic wall, and that fascia is called as internal thoracic, excuse me, it's called as endothoracic fascia. Okay, so endothoracic fascia then is the guy which is covering the whole thing from the, like, it covers the whole internal side of the thorax. So even if in case they ask you to show us the endothoracic fascia, so again, get the thoracic wall, look at the posterior side of it. So basically endothoracic fascia has to cover everything here before seeing all these muscle fibers. So that's the endothoracic fascia. Even you can actually show it to the examiner in this way. So that was the easy one, and it's not a big deal, to be honest. All right, then I think we covered like the muscles and everything properly. In your topics, you have the axioappendicular muscles. Well, it's all from the upper limb. So again, I put the pictures of the pages of the upper limb to it again. So I'm gonna tell you quickly, anterior axioappendicular muscles were pec major, pec minor, subclavius, and serratus anterior. All right, so I'm not talking about them more. The tables are attached here. Don't really get to the attachments and the details. Know the innervation and the main action. Just know one of them, and that's it. All right. Posterior axioappendicular muscles were trapezius, latissimus dorsi, then levator scapulae, and rhomboid minor and major. So these guys are also covered in the upper limb, so you've been over them. Just take a look at them and revise them quickly. So I don't want to waste time on these muscles, and make sure you're gonna revise their ID again on the cadaver. Okay, so that's pretty much about the muscles. All right, let's start to talk about the nerves supplying the thoracic wall. So since we've got 12 ribs, then we have 12 nerves, 12 pairs of nerves to supply the thoracic wall. So basically you have the nerves from T1 down to T12. Okay, so then as we know that those nerves are actually running in the intercostal spaces, so then you have 11 intercostal nerves, and then the nerve which is running right under the 12th rib is called as subcostal nerve. All right, that's how easy it is. So then 11 intercostal nerves you have, and one subcostal nerve you have on each side. So all these guys are in pairs. Okay, so intercostal nerves, to know them more, so as I told you that they are responsible to supply most of these muscles of the thorax. It's all good, it's all covered. But what I wrote about them here is that you have to know that intercostal nerves are divided into two groups. There is the typical intercostal nerves, and there is also the atypical intercostal nerves. So typical intercostal nerves, it means that these guys, they are having some common features together with each other. All right, and even some of them are common between all of those intercostal nerves. The atypical intercostal nerves are just some exceptions that they are doing something different than it has to be. Okay, So intercostal nerves, 3rd to 6th intercostal nerves. These are the typical intercostal nerves. So the way that they are giving branches and everything, it's so obvious and so similar to each other, all of them. So let's take a look at this picture. So at this transverse cut, you can see the spinal cord running in the spinal canal, all good. Then you can see the spinal nerve coming out through the space between two vertebrae, which was called as intervertebral foramens. Then the spinal nerve divides to a posterior ramus, which goes toward the back. It's already good, we've done it, and anterior ramus. So the anterior rami of the thoracic nerves, they form the intercostal nerves, as well as the subcostal nerve. Okay, but the thing is that we know that over here, we have the sympathetic trunk running anterolaterally to the vertebral body. Good. And we already talked about the connection between the anterior ramus and the sympathetic trunk, that we said that we have these communicating nerves, which we call them as rami communicants. The one which is located more laterally is the white rami communicant. So this is the pre-party guy, all right? So it has the presynaptic nerves. And the one which is running more medially, this guy is the gray rami communicant, which is the postsynaptic nerves or after party one. Now, and remember that these guys are actually visible on the cadaver, so you can ID them. So it's just enough for you to remove all the lungs on each side, or each of the lungs if you take them out. If you run toward the more posteromedial side of the thoracic wall, so you can actually get to see the vertebrae, and you find the sympathetic trunk running down all the way, which is easy to find it. And then you will be able to find the sympathetic ganglia on each level. And once you find the intercostal nerve coming out, so between them, you're gonna find the rami communicants definitely. If you haven't seen it, ask your teacher to show it to you. All right, so then the common feature between the intercostal nerves is that they have rami communicants. That's the first thing. Then as you see, there is the intercostal nerve or it's running between the innermost and internal intercostal nerves. And of course, you know that it supplies them. So the intercostal nerves, they are giving us the muscular branches. Easy. As the intercostal nerve reaches around the level of the mid-axillary line, remember the mid-axillary line? We talked about it over here. Where is it? Here. This was the mid-axillary line. So around the level of the mid-axillary line, each of those intercostal nerves, they give us a lateral cutaneous branch. It means that this nerve is a cutaneous nerve piercing through the muscles and comes out toward the skin. And it gives you a posterior and anterior branch to supply the skin areas behind it and anterior to it. And as you see over here, the intercostal nerve, it's still continuing. And once it's reaching paraesternally, then it's giving you the anterior cutaneous branch. Again, to supply the skin, which is located more on the anterior side of the thoracic wall. So far, how many branches did we talk about? Rami communicants 1, muscular branches 2, lateral cutaneous branch 3, and anterior cutaneous branch, where is it written? Here, 4. Okay, so these are all common features that we have in the typical intercostal nerves. One more thing to add. On this picture, if you see the intercostal nerve enter the intercostal space, the rami communicants you can see so nicely. What else you find? Once you reach to the angle of the ribs, right at the level of the angle of the ribs, the intercostal nerve gives you another branch which is running more inferiorly. So it's running basically toward the superior border of the rib below it. And that's called as collateral branch. Okay, so collateral branch. So then 5 branches that we need to know about the intercostal nerves, which are typical: ramicommunicants, collateral, lateral cutaneous, anterior cutaneous, and muscular branch. Okay, so MAL is mid-axillary line. Remember, parasternal line is also written here for the anterior cutaneous branches. Good. Let me see. All right. So I think I'm gonna be pausing the recording because I don't want to be interrupted later on. So I will continue with the atypical nerves in the next video. Let me just see if I missed anything or not. So it's all good. One more thing before I pause the video. Something that you have to keep in mind is that, you know, back in the basics of the ribs, let me find a proper picture. All right. So this is a posterior view of the 6th and 8th ribs. Okay. So if you see over here, on the lower portion of the ribs toward their inferior margin, you have a groove here which is called as costal groove. This is where the intercostal artery, vein, and nerves are supposed to be running. Okay, so they are actually the nerves and vessels, they are running in the intercostal grooves. So if you look at the posterior view, or let me move it to the application, is better. So if you look at the ribs posteriorly, okay, so we know that the nerves are coming out. Ooh, such a mess. So this is the one intercostal nerve that you're seeing here. Wait up. Okay, that's an intercostal nerve. And as you see, the intercostal nerve is running right below the ribs. So they're actually running in the on the costal grooves. All right. And the thing is that what I want you to know is that the main intercostal nerve is passing in the costal groove, so right below the let's say ribs, which are supposed to be there, and the collateral branch runs toward the superior margin of the other rib. So in case if we want to do a needle insertion into the intercostal space, what we have to do is to that insert the needle right above the ribs, because you know that below the ribs in every level you have the main intercostal nerve running, so you can damage the intercostal nerve at that level. Okay, so if you want to do an needle insertion in the intercostal space, the doctors are always choosing superior border of the ribs, because there is no major intercostal nerve running, and if they damage the collateral branch, it's not a big deal, and that doesn't really happen. But in case if they damage the intercostal nerve at this specific level, then that whole level would go like paralyzed. Okay, so the muscles wouldn't be to contract, the skin sensation would have, let's say, disturbed, and so on. All right, so that's a common question they ask you, is that where would you insert the needle? Above the rib. Why? Because below the ribs, on the inferior border, you have the intercostal nerves running. Okay, and also something else which is important is that the order of the nerve and vessels which are actually located there, from superior to inferior, you have the vein, artery, and nerve. Okay, so nerve is the one which is located more inferiorly compared to the vein and the vessels. All right, so that's pretty much for now. I'm going to share you the new link and we will continue it over there.